So, thank you first of all that I can be here today. It's really a pleasure. My name is Dr. Erat. I'm a medical director in Hirslanden clinic in Zurich, in charge of preventive medicine and personalized prevention. I'm, however, originally from Finland. I grew up there, although I'm half Swiss, so I'm from quite a multicultural environment. And I fairly early on moved abroad to explore the world. And I was always involved in sports. I was also competing also on international level in skiing. And nowadays I somehow ventured into bobsledding and monobobsledding. So I'm really into winter sports, of course, because I'm from Finland, so that comes quite naturally. And through that I also then entered into the world of sports medicine. I'm in the national teams of ice hockey as a medical doctor, and we take care of some Formula One drivers, and so it all came quite naturally in direction sports medicine, prevention, and now also personalized prevention. I feel very fortunate to be in Switzerland. This is of course a fascinating environment for a doctor, a scientist, also a health systems expert, because we have the NGOs, we have the WHO, we have the pharmaceutical industry, all kinds of biotech and digital medicine startups, and of course hospital systems that are excellent in quality. So it's thrilling. So in our department we focus on preventive medicine, and particularly personalized prevention, which really incorporates lifestyle, sports, nutrition, whatnot, with genetics and then medicine, traditional medicine. We have coaching, so we really try to help people optimize their health, whether they are chronically ill or whether they're top athletes that want to go and win the world championships. And so, of course, we have, for instance, ice hockey players, Formula One drivers that really then have to go and win, ideally. But we also have completely normal people, hobby athletes, or someone with a chronic disease such as, let's say, diabetes. And there's so much you can do in terms of prevention to optimize the health, even in chronic disease, and avoid complications. So that's what we mainly do. But of course, we're a teaching hospital as well. So we have students that come to learn medicine and we teach them. We also have resident doctors that we teach. So it's really a very, very broad spectrum. So the concept of personalized prevention and prevention is not completely new. It will have much more weight in the future. We will look much more at how to optimize health and avoid disease. But it's not completely new. Already in the UN Declaration of Human Rights in 1948, the definition of health and the right to health was really about attaining the best possible health for every single individual. And that was, of course, groundbreaking then, but we're going more and more in that direction. And in 10 years' time, we will really be immersed fully in preventive medicine and in personalized medicine. We will integrate much more gadgets, wearables, such as shirts with monitors in the fabric, or Aura rings, which will be, of course, developed severely. Also all kinds of wearables like Apple Watches and new watches that we can't even imagine, to be a part of the everyday clinical care of our patients. The patients, not only in the lifestyle sector, but really the patients that are maybe suffering from a chronic disease, they can be monitored real time from home. And this data can then be transferred directly to the treating physician through, for instance, technologies such as the Internet of Things, IoTs, which is kind of like a postman between the doctor and the patient. We will also have more artificial intelligence involved in the everyday care of patients. And then, of course, genetics. So we will be able to not only look at the lifestyle, but also the genetic background, the chromosomes, the genes, and integrate that into the care, and also cater and also design therapies that are based specifically and personalized to the patient's genes.